Here's one that we can probably solve for you in literally like 10 or 15 minutes. Do you deal with headaches, fatigue, a stuffy nose, or sinus pressure from time to time? Maybe you deal with it nearly all the time. Well, there's an advanced procedure out there that could change your life, and here with us today is Dr. Gould, the medical director of the St. Louis Sinus Center. He's an internationally recognized expert with this procedure. His office is a national center of excellence, which means basically his peers come from across the country and he trains them on this procedure. Along with Dr. Gould, there on the end, right next to me, is one of his patients, Tony Brinkley, who went through this procedure about 4 months ago. Gentlemen, welcome to both of you.
Thank you.
Thank you.
Very nice
Thanks
to
for
have you
having
here.
us.
And always great to talk to somebody who's been through a procedure like this and has had such great success. We'll do that in a minute. But first, Dr. Gould, hit us with some numbers. How many Americans are dealing with this day in and day out?
Well, it's really actually huge. So 37 million, as you mentioned earlier, suffer from sinusitis, and many of them don't actually know what's causing the problem.
And you were in that camp, Tony, for a long, long time. So tell
Yes,
me,
it was.
how did this impact your life?
Oh, it just opened up a whole new life for me. There were I guess, progressively for about the last 10 years of my life, it just kept getting worse and worse and worse. Wintertime was always really bad. You know, I had the itchy, watery eyes, the runny nose. I couldn't breathe at night. I'd try to lay down, and then it got so bad that it completely stopped up. No, there was no relief at all.
So this is sinusitis.
Yeah, and Tony had nasal congestion was a major factor for him. He literally could not breathe through his nose at all when he came in. You were using Afrin and neosynephrine constantly. Had tried every remedy over-the-counter, prescription medications. Nothing was working. And then we went forward with the balloon dilation procedure.
Well, let's hear a little bit more about that, because that's sort of your specialty. That's what Tony went through. So tell me about this.
Yeah, so the balloon sinus dilation is indicated for patients who have chronic sinusitis that is refractory to conventional medical therapy. So if antibiotics aren't working, nasal sprays, things like that aren't helping, then balloon sinus dilation might work. Chronic sinusitis is really a condition that affects the lining of the nose and the sinuses, where there's persistent inflammation or infection that just will not resolve. And sometimes it's related to a blocked sinus opening, and usually, in fact, it is. And so we have this device, it's called Express Balloon Sinuplasty, and it's basically a little device, and if you can focus in on it here, you can see there's a light at the end that helps guide us to where we need to go inside the nose and sinuses, and then there's a little balloon that we just inflate once we get it inserted into the sinus opening that's blocked. And so without surgery, without any cutting, we're able to go in and open the blocked sinus. We leave the balloon up for about 10 to 15 seconds, deflate it, and then slip it back out, and we're done. So it's really simple, and we showed how simple it was here on set before when we did a patient live in studio previously, and that worked really well. So
Tony, you had this procedure done about 4 months ago. I want to hear about that day, what the process was like, and then what life has been like since.
Immediate relief.
Really?
There was no pain whatsoever, just a slight amount of discomfort. And I mean, I was awake through the whole thing. The staff, you know, they were all around me, you know, asking me, making sure everything was okay. And of course, everything was fine. And Dr. Gould would ask me, you know, are you doing okay? I said, well, yeah, I'm doing just fine. So anyway, after the procedure, he raised me up in the chair, and for the first time in, I can't remember, I could actually take a deep breath through my nose. Wow. And I asked him, I said, is this going to stay like this? And he said, there will be some swelling, but even with the swelling, it was nothing near severe as what I had before. And now it's like a brand new nose. Like I had a nose transplant.
Yeah, and these are stories we hear every single day. This is not atypical. This is very common. Right. And the good news is the results are durable, and that's been shown and proven in multiple studies. The other cool thing that Tony touched on is that we do this in the office while patients are awake. We give a little bit of oral sedation to make you relaxed, but it's done in the office, and you're back to normal activity. Usually within 24 hours, so that there's very little downtime associated with it.
Fantastic.
Now, I went back to work the next day.
Oh my gosh, that's great.
It's great, yeah.
Thanks for sharing your story, Dr. Gould. Always nice to see you too and hear about the latest out there. St. Louis Sinus Center is a national center of excellence, as we mentioned, accepting new patients right now. So if you're ready to end your sinus suffering like Tony did, get in touch with the St. Louis Sinus Center, 314-4RELIEF. That's 314-473-5433. Or check them out online too, www.stlsinuscenter.com. KMOV.com. Virginia?